So let's talk about diagnosis. How do we make the diagnosis? Because we now think that this is important, right? Obviously, it can affect your future if you have a fracture. Seems to be common as we get older. So how do we diagnose this? So for example, let's start off with an office visit. So let's say the doctor is looking at the patient. Are there signs that we can see that points us to that? So Dr. Jain, what signs are we looking for when we're just looking at a patient?
Oh, absolutely. It could be at any office visit where the patient may have come for a completely different reason in the office. But if the doctor notices that, say, for instance, the patient is hunched over, has what we call kyphosis or a hunchback, that is a very strong predictor. If we find out from a medical history that someone is having recurrent falls, so two or more falls in the last year, that is a concern as well. And of course, a previous history of a fall is a very strong predictor of future falls. So a lot of different factors that we look at in the screening part.
So we're looking
Yeah,
at Dr. Brown?
yeah, I would say in family medicine, there's two questions that I always want to ask somebody. One question is, have you fallen or broken anything in the last year that I don't know about? Because sometimes people will fall and go to the hospital, get a cast, and their family doctor may never hear that story. And the second thing that I always do is I measure height. We don't expect people to grow after a certain point, but we want to be sure they're not shrinking. Because when you start to see height loss that you've recorded, and they tell you, yes, they fell a couple of times, as Dr. Jain mentioned, you know right from the get-go that they're at risk.
Right, that's important, right? So if you have height loss, it means that thing that you guys were talking about is already happening with the compression. And then with the kyphosis, they get bent. Because I know that everybody says, yeah, grandma was kind of staring at the floor eventually. And then also, this idea of I heard about the between your head and the wall space. Could you explain that a little bit? Dr. Jain, do you want to explain what the head to the wall distance is?
Yeah, absolutely. So the occiput wall ratio. So generally, when we stand against the wall with our back on the wall, we should be able to touch the wall with the back of our head. But in individuals who have had fractures in the vertebral column or those who are hunched over, they're just not able to straighten out their back and their head. And if the back of the head is not able to touch the wall when you're standing at a comfortable posture, then that indicates that the patient may be or the person may be at risk of having had fractures that they may not be aware of in the spine or having osteoporosis.
So that whole business about compression is happening with the curvature, your head is pulling away. And I think that's something that we can do with our loved ones, right? As patients, I guess, if you look at your mom or your dad and all of a sudden you see that they're getting, shorter, as they say, then that would be a sign that's there.